Hello, beautiful listeners, and welcome back to Green Earth Essentials. I'm your host, Michelle Jackson, and today we're diving into the icy world of cryotherapy. You've probably seen those sleek cold chambers popping up in wellness centers, promising everything from pain relief to boosted mood and faster recovery. But what's actually happening beneath the surface? Today, we explore how cryotherapy affects your body at the cellular level. Cryotherapy literally means cold therapy. It involves exposing the body to extremely cold temperatures for short bursts of time. This can be done through whole body cryo chambers, localized treatments using cold packs or nitrogen jets, or even natural exposure like cold plunges or winter swims. Though it may feel like a modern biohack, cultures have used cold for centuries, from Finnish ice baths to ancient Roman frigidariums. When you're exposed to intense cold, whether in a cryotherapy chamber or an ice bath, your body kicks into survival mode almost instantly. The first physiological response is vasoconstriction, where blood vessels narrow to reduce blood flow to the skin and extremities. This helps conserve heat around vital organs and slows down metabolic activity in peripheral tissues. It's the body's built-in way of protecting itself against heat loss. This constriction also plays a role in reducing inflammation, especially in areas recovering from stress or injury. By limiting blood flow, the cold suppresses the migration of immune cells that can contribute to swelling and tissue breakdown, giving sore muscles or joints a chance to recover. At the same time, cold exposure triggers the release of norepinephrine, a hormone and neurotransmitter that sharpens focus, elevates energy, and can help reduce pain perception. This is accompanied by a surge of endorphins, the body's natural opioids that generate a sense of euphoria and well-being. That cold rush people feel post-session isn't just psychological, it's biochemical. Interestingly, studies from institutions like the Karolinska Institute in Sweden suggest that even short exposures to cold can increase sympathetic nervous system activity, raising alertness and increasing metabolic rate. That's part of why people often describe feeling awake or clear-headed after cryotherapy. For athletes and biohackers alike, this immediate reset is one of the major draws of cold-based therapies. Now, let's go deeper into the microscopic world of our cells. When the body is exposed to extreme cold, it initiates a cellular defense mechanism designed to protect, repair, and even strengthen tissues. One of the key players in this response is a group of molecules known as cold shock proteins. Among them, RNA binding motif protein 3, or RBM3, has become the subject of growing interest in scientific studies. RBM3 is expressed when body temperature drops and plays a crucial role in maintaining RNA stability and promoting cell survival during stressful conditions. Think of it as cellular insurance. It helps your cells stay functional and productive, even when they're under duress. RBM3 supports the repair of damaged synapses and has even been linked to neuroprotective effects in the brain. In a groundbreaking 2015 study published in Nature, researchers at the University of Cambridge found that RBM3 was upregulated in mice exposed to cold temperatures and played a vital role in preserving brain synapses. What's more compelling? In models of neurodegenerative disease, mice that produced more RBM3 had slower progression of Alzheimer's and prion disease. That's right, cold exposure may have implications far beyond recovery and inflammation. It could play a role in protecting brain health. But RBM3 is only part of the story. Cold exposure also stimulates mitochondrial biogenesis, the process by which new mitochondria are created inside cells. Mitochondria are often referred to as the powerhouses of the cells because they generate ATP, the energy currency that drives virtually every cellular process. When you have more and healthier mitochondria, your cells become more efficient at producing energy, repairing damage, and even resisting age-related decline. This boost in mitochondrial density is particularly beneficial for muscle recovery and endurance, as well as for general metabolic health. Cold-induced mitochondrial biogenesis has been observed in both brown adipose tissue, the body's heat-generating fat, and skeletal muscle. These effects are similar to what we see with endurance training, except here it's prompted by environmental stress rather than exercise. Additionally, cold exposure appears to activate AMP activated protein kinase, AMPK, a key energy sensor in the body that plays a role in cellular health, metabolism, and longevity. This ties cold therapy to many of the same beneficial pathways activated by fasting or calorie restriction, two well-known strategies for enhancing lifespan and metabolic flexibility. In essence, when your body is exposed to cold, your cells don't just brace for impact, they adapt, strengthen, and evolve. Cryotherapy isn't just about feeling better in the moment, it may help future-proof your cells against the physical and neurological stresses of modern life. Chronic inflammation is now recognized as a silent driver behind many modern ailments, from autoimmune disorders and cardiovascular disease to anxiety, depression, and even cancer. Unlike the sharp, localized inflammation you might get from a cut or sprain, chronic inflammation is subtle, systemic, and persistent. This is where cryotherapy can play a meaningful role. When you expose your body to intense cold, it quickly shifts into anti-inflammatory mode. At the molecular level, cryotherapy suppresses the production of pro-inflammatory cytokines, chemical messengers that amplify inflammation throughout the body. Two major culprits, interleukin-6, IL-6, and tumor necrosis factor alpha, TNF-A, are often elevated in individuals with chronic inflammatory conditions. Multiple studies, including those published in Frontiers in Physiology and Journal of Inflammation Research, have shown that cryotherapy can significantly reduce IL-6 and TNF-A levels, leading to measurable improvements in inflammatory symptoms. At the same time, cold exposure boosts levels of anti-inflammatory cytokines, particularly interleukin-10, IL-10. IL-10 helps suppress excessive immune responses, preventing the kind of immune overactivation that can lead to tissue damage, In conditions like rheumatoid arthritis, lupus, or multiple sclerosis, it also encourages the immune system to reset, reducing autoimmune flare-ups and overreactions. Real-world examples back this up. In a 2011 study of patients with fibromyalgia, participants who underwent whole-body cryotherapy reported reduced pain sensitivity, lower fatigue, and better sleep, all of which corresponded with measurable reductions in systemic inflammation. Similarly, for athletes, cold immersion has been shown to reduce post-exercise inflammation and muscle soreness, enabling faster recovery and better long-term performance. But perhaps the most intriguing is how cryotherapy affects immune cell function. Short bouts of cold exposure appear to enhance the activity of natural killer NK cells, the immune system's frontline defenders against viruses and tumors. NK cells play a vital role in patrolling the body for infected or abnormal cells and eliminating them before they become a serious threat. Boosting their function not only supports overall immune health, but may also contribute to cancer surveillance and viral resilience, especially in times of stress or aging, when immune performance typically wanes. There's even evidence that cold exposure increases the production of white blood cells and improves lymphatic circulation, helping the body clear out toxins and immune waste more efficiently. This means that even a few minutes in a cryo chamber or cold plunge may kickstart a cascade of immune recalibration, priming the body for better balance and resilience. Cold therapy has long been a trusted tool in sports medicine, and for good reason. When applied to injured or inflamed tissue, cold exposure quickly reduces nerve conduction velocity, meaning the nerves transmit pain signals more slowly to the brain. This results in a natural analgesic or numbing effect, helping to relieve both acute and chronic pain without the need for pharmaceuticals. But cryotherapy does more than just dull the sensation of pain. It also addresses some of its underlying causes. For example, by constricting blood vessels in inflamed tissue, a process known as vasoconstriction. Cryotherapy reduces swelling and fluid accumulation in the affected area. Once the cold is removed, vasodilation follows, bringing in fresh oxygenated blood and promoting tissue repair. This cold then warm rebound effect accelerates recovery and reduces lingering soreness. Localized cryotherapy, where cold is applied directly to a target area using cryospray, liquid nitrogen, or cold packs, is particularly effective for conditions like tendinitis, bursitis, arthritis, and joint sprains. In a 2020 clinical trial published in Pain Medicine, patients with knee osteoarthritis reported significant reductions in pain and improved mobility after a series of localized cryo treatments, with effects comparable to some anti-inflammatory medications. Even migraines can be eased through cold therapy. Applying cold packs to the back of the neck or forehead during an attack can cool the blood flowing to the brain, reduce neurogenic inflammation, and lower serotonin levels, 3 key contributors to migraine pain. In fact, research in Headache, the Journal of Head and Face Pain, has found that targeted cooling of the carotid arteries can reduce migraine severity in many patients. For chronic pain sufferers, including those with fibromyalgia or neuropathic pain, whole body cryotherapy, WBC, offers promising results. A short session in a cryo chamber, usually lasting 2 to 3 minutes, at temperatures between minus 110 degrees Celsius and minus 140 degrees Celsius, can reduce pain perception for hours or even days afterwards. This effect may be due to a mix of endorphin release, anti-inflammatory signaling, and modulation of pain pathways in the brain and spinal cord. Cryotherapy is also increasingly being used in conjunction with other therapies, such as physical rehabilitation, chiropractic care, and acupuncture. It can act as a primer, reducing pain and muscle tension so patients can engage more fully in movement-based therapies without discomfort. One of cryotherapy's most intriguing effects is its ability to activate brown adipose tissue, or BAT. Unlike white fat that stores energy, brown fat burns it to generate heat through non-shivering thermogenesis, a process cryotherapy taps into to help maintain body temperature. When the body is exposed to extreme cold, either through whole body cryotherapy, WBC, or consistent cold exposure like ice baths, it sends signals to ramp up heat production. This triggers the activity of mitochondria-rich brown fat cells, primarily located around the neck, collarbone, and spine. These cells start burning glucose and fatty acids, increasing overall energy expenditure. That's why some researchers are investigating cryotherapy as a possible aid for weight management and metabolic health. In a 2014 study published in Diabetes, researchers found that regular exposure to mild cold increased brown fat volume and insulin sensitivity in adult men, suggesting that consistent cryo-style exposure could be beneficial for people at risk for type 2 diabetes or obesity. Another study from the Journal of Clinical Investigation found that cold-induced brown fat activity could increase resting metabolic rate by up to 15%, depending on duration and individual physiology. Cold therapy may also promote the browning of white fat, transforming it to behave more like brown fat, increasing thermogenic capacity. Even brief exposures like cold showers or cryo sessions may enhance metabolic flexibility. There's also a hormonal side to consider. Cold exposure may increase levels of adiponectin, a protein hormone involved in glucose regulation and fatty acid breakdown. Higher adiponectin levels are associated with a lower risk of cardiovascular disease and better insulin function. While it's not a magic fix for weight loss, cryotherapy shows promise as part of a broader wellness strategy. From metabolic clinics to athletic centers, the science around cold exposure is heating up. Athletes from marathoners to MMA fighters use cryotherapy to speed up recovery and reduce delayed onset muscle soreness, DOMS. The extreme cold triggers vasoconstriction, which limits swelling and inflammation. As the body rewarms, vasodilation increases blood flow, helping deliver oxygen and nutrients to muscles for faster repair. Research suggests cryotherapy lowers muscle damage markers like creatine kinase, CK, and boosts perceived recovery. It may also reduce mental fatigue by elevating norepinephrine and endorphins, improving focus and pain tolerance. However, timing matters. Using cryotherapy too soon after strength training may blunt muscle growth by interfering with inflammatory pathways needed for adaptation. That's why many trainers recommend it during rest days or competition recovery. Top athletes like LeBron James and Cristiano Ronaldo swear by it, and sports teams worldwide now make cryo chambers part of their recovery toolkit. Cryotherapy isn't just physical, it's also profoundly mental. When the body is exposed to extreme cold, it triggers a surge in norepinephrine and dopamine, two powerful neurotransmitters linked to mood regulation, alertness, and motivation. These chemicals don't just help us feel good in the moment, they support improved focus, resilience to stress, and even neuroplasticity, the brain's ability to rewire itself. Studies from European cryo clinics have shown that regular whole-body cryotherapy sessions may significantly reduce symptoms of depression and anxiety, particularly when combined with traditional therapies. One 2014 study published in Psychology Research and Behavior Management found that patients with depressive and anxiety disorders reported better mood, sleep quality, and vitality after just a few cryo sessions. The mechanism? Cold acts as a hormetic stressor, a short, controlled dose of stress that pushes the body and mind to adapt. Much like exercise or fasting, this temporary discomfort seems to build resilience over time. Cold exposure may also lower cortisol, the primary stress hormone, creating a calming after effect once the session ends. Some veterans' health programs are now exploring cryotherapy as a non-pharmaceutical adjunct for PTSD. While research is still emerging, early results suggest promise, especially in helping individuals reset their nervous systems, calm intrusive thoughts, and regulate emotional reactivity. In a world where burnout and overstimulation are common, cold may offer a paradoxically soothing form of therapy, a moment of stillness in a chamber of ice. While generally safe, cryotherapy isn't for everyone. People with cardiovascular issues, Raynaud's disease, or cold allergies should steer clear. Overexposure can lead to frostbite or skin burns. Always consult with a healthcare provider and use reputable facilities with safety protocols. Research is just beginning to uncover the full potential of cryotherapy. Universities are studying its use in neurodegenerative diseases, metabolic disorders, and even cancer therapy. As access grows and methods refine, cold therapy may become a key pillar of holistic health and wellness. So, next time you dip into an icy plunge or step into a cryo chamber, remember it's not just about grit, it's about cellular health, resilience, and balance. Thank you so much for listening to Green Earth Essentials. If you enjoyed this episode and want to support what we do, head over to patreon.com/Green Earth Essentials. Your support helps us bring you more science-backed stories from the front lines of natural wellness. Until next time, stay grounded, stay curious, and stay cool. This is Michelle Jackson, signing off.